Now, the second lecture in our series, Ankylosing Spondylitis from A to Z for patients. Prevalence of Ankylosing Spondylitis. The worldwide prevalence of Ankylosing Spondylitis is 0.1% to 1.4%. This means that on the average, out of every 1,000 persons, 7 will have Ankylosing Spondylitis. It's 1 to 14. And what about their ages? What is their average age? Well, approximately 80% of patients with ankylosing spondylitis experience symptoms at between 20 to 30 years of age, and only 5% will present with symptoms at more than 45 years of age. Actually, even those who present after 45 years of age, their disease actually started when they were also in their 20s or early 30s, but it was so mild that it came to recognition only, and they sought medical advice only when they were in their late 40s or early 50s. As we know, the most common symptom in ankylosing spondylitis is chronic back pain. Does that mean that if I see a patient with chronic back pain, which means back pain for 3 months or even or more, 3 or 4 months or more, if I see a patient with back pain for 3 months in the clinic, that ankylosing spondylitis will be the first thing that comes to my mind? Of course, no. The answer is no. Not immediately, definitely not immediately at least, unless in certain situations. So why not immediately, and what are those certain situations? Why not immediately? We start with that one. Because back pain is so common in humans, and the most common cause of back pain in humans are a list of causes that are not ankylosing spondylitis. So how common is back pain in humans, and what are those commoner causes for back pain? 20% of humans have some sort of chronic back pain. So this means that 1 in every 5 persons have chronic back pain. Think how many of your friends and relatives have back pain. There are so many. So what are the most common causes for chronic back pain? Weak abdominal muscles, sitting for many hours daily, sitting in front of the computer, poor posture when sitting, increase in weight, poor posture when carrying objects, carrying school bags, lack of participation in sports. All those are very common causes. When we look at the big population of all patients with chronic back pain, which are 20% of the general population, this is a very big population. When we look at that big population, how common is the patient with chronic back pain due to our disease, due to ankylosing spondylitis? Only 0.5%, which is 1 in every 200 persons. This is a very tiny percent, very tiny proportion of the big population of back pain patients. Note that ankylosing spondylitis mostly starts in those who are young, like 20 to 30 years of age. This brings us to those special situations where we can consider ankylosing spondylitis to be more likely to be the cause of back pain. Those who are younger than 40 years of age. So when we look at the big population of all patients with chronic back pain who are younger than 40 years of age, so how common is the patient with chronic back pain due to ankylosing spondylitis here? It's 5%. 5%. It's 5 in every 100 persons with back pain. So when a 25-year-old man comes to my clinic, to a rheumatology clinic, complaining of back pain that has been troublesome for the last 6 months and has been persistent for 6 months, yes, I would definitely, this doesn't mean that he has ankylosing spondylitis, but I will definitely have ankylosing spondylitis in my likely considerations. Now, the last piece of information concerning the prevalence of the disease, it's the male to female ratio. Ankylosing spondylitis is more common in males than in females. The male to female ratio is probably 2 to 1 or 3 to 1. So for every 3 males with ankylosing spondylitis, 1 female has ankylosing spondylitis. Thank you so much.